Good afternoon, everyone. Welcome to our community mental health meeting. Thank you, everyone, for being here today. Medina County acknowledges the importance of mental health. It impacts us in one way or another, and it's through open conversation and shared understanding to help build resources and navigate our way on mental health for our community. The purpose of today's meeting is to help focus, listen, and learn about raising awareness for mental health and exchange thoughts, ideas, and discuss community resources to help improve a stronger restoration of mental health in Medina County. The space is not about judgment, it's about support. There are valuable mental health resources available to our citizens through our local MHDD who are here with us today. In addition, Medina County is working hard to implement in-house jail restoration services to support our defendants more effectively during their time in custody. We're also exploring ways to expand outpatient competency restoration options. With that being said, thank you everyone for being here, and I would like to introduce some of our main players in Medina County. Can I start with you?
Hello everyone, my name is Michelle Zammeyer. I'm the Director of Forensic Services for Hill Country MHDD Centers.
Sue Devine, I'm the MH Clinic Director here for Medina County.
Hi, I'm Joan Cortez. I'm the Director of Crisis Services for Hill Country MHDD.
Hi everyone, my name is Anthony Wynn. I'm the Senior Director of Mental Health for Hill Country MHDD Centers.
Good afternoon, everyone. My name is Landon Sturdivant, and I serve as the Deputy Chief Executive Officer for Hill Country Mental Health and Developmental Disabilities.
I am Todd Winslow, Director of Adult Probation.
My name is Catherine Romero. I work with the Sheriff's Office, and I am the liaison between the jail and the courts.
I'm Deputy Antonio Aguilar with Medina County Sheriff's Office. I am the Medina County Mental Health Officer.
Ariel Solis, I'm the Jail Administrator at the Medina County Jail.
Manuel Salazar, I'm the Jail Lieutenant at the Medina County Jail.
Mark Cashin, County Court of Law Judge.
Keith Lutz, County Judge, Medina County.
I'm Christy Ivey. I'm representing the Medina County pretrial.
Maggie Squires with the Medina County DA's office. And Dominique Brevity, also with the Medina County Criminal District Attorney's office.
And I believe our public defender office just walked in. Yeah, and I'm Jana. I work with Judge Cashin, Medina County Court of Law. So, since the public is here, does anybody have any questions for us? Like any gaps in the system, anything that you feel like you want to address? No?
Okay, that was kind of the main purpose of this, and I know we got out some late notices. We tried to get people notified as much as possible. We know we have gaps in our system, and people that are being put in jail, that I guess the biggest frustration for me is we get them arrested, 15, on my cases, because they're misdemeanors, usually 15 days later, we PR them because they're out, and it's criminal trespass, nonviolent crimes normally. We wanted to hear from the public. If you have family members, if you have anybody that you can tell us, this is what services y'all could provide to help us. Is there anybody here that, I don't see a lot from the public. Most people I see are government employees. Is there anybody here that has anything they want to say to give us some instruction? Go ahead.
Hi.
Thank you.
I'm Dr. Kristen Rumley, and I'm from the Department of Veteran Affairs. I'm the Community Engagement and Partnership Coordinator for Suicide Prevention, South Texas VA, and I'm assigned to Medina County, and it's only been a couple months, so that's why you guys probably don't recognize me. But basically, when I started, I'm assigned to like 17 counties, by the way, is to do a gap analysis, and one of the things that I've seen is with the Veteran Services Officer, there is not a mental health resource in Medina County for veterans. And so that is a huge gap. And people don't want to drive to San Antonio. They don't want to drive to Audie. So we have a huge mental health gap. And all of the research that the VA does with suicide prevention shows that a veteran who is not engaged with VA or healthcare is at an increased risk for suicide. Also, rural veterans are at increased risk for suicide. So my position comes into the communities kind of like this to create teams, like coalitions, to address either veterans issues or mental health issues, but try and do exactly what you guys are saying. But the biggest gap is lack of resources and what to do when someone needs assistance with mental health.
Could I ask? What would be your, I guess, your ideal scenario to help fill that gap?
So that'd be really easy if I had an answer, but the idea is to get a group together to first identify what is the problem. So maybe the problem isn't just veterans, maybe the group is for the county, right? And what is the issue? Do we need more sites to do virtual counseling? Do people need to do something locally with virtual counseling because they don't have the equipment in their home? So we would, as a team, sort of look at what the problem is. I just think that it varies based off of the gap. So, for example, in Travis County, one thing that they're doing is lethal means safety is a huge part of what we do, lethal means safety. They are putting together a trifold for any gun distributor to give out on lethal means safety. And it also incorporates the veteran community because that's our veterans also have firearms. There's another county that it's about connectedness. They're feeling that veterans aren't coming out of the house. This is in Goliad County, that nobody's coming out of the house. So we're trying to build ways to connect veterans, even veterans who are in their home and can't come out. And again, I know I'm speaking from the veteran voice, but this stuff could be for anybody. So I don't have an easy solution, but I definitely think that what you guys are doing with everyone talking is the best.
Well, something you mentioned was like a mobile, virtual type of situation. And there was a meeting I was at with you that it was not for mental health, that we're doing some other sort of resource where a bus would go to, say, Walmart and Cashville, and they had basically computers in that bus, and they were able to meet with people. Something like that kind of sounds like it would be helpful if it was able to shift from maybe area to area to area based on the needs.
Yeah, so the VA does have the vet centers, the mobile vet centers they can bring out. The VSOs kind of feel that that's not meeting the full veteran need because the vet center doesn't diagnose and do full mental health assessments like that. So that was one of the issues the VSOs brought up. But since a lot of people don't have maybe the option to do virtual, it was a little brainchild I had. Like, why don't we have a room where people can just come in and do their virtual appointment? But I don't know if that's, I don't know how big of a need that is.
So I might just add in there, because you said, first of all, you're going to you're on the wrong side of the fence. You've officially been welcome to this side of the fence, because that's exactly the code. So the good news is we have been working on exactly what you need to be a part of. But my question was on the, so we use the bus and we had it here in our county then? Did we have it in an event?
No. This is something totally different. It was just an example I was bringing up.
Okay.
I think it was Texas Workforce that was doing something like that.
Right. So one of the things that we have in our county that's unique to our county is we have where people can do their Social Security appointments virtually, and we use that room in each one of our buildings. One time a month, and then in Castroville there's one time a month, and in Devine there's one time a month. But my point to that is we have a room that is set up for virtual meetings that, may be an idea for something like this to be able to say, hey, these days it's committed, but we could add a day or something a month or 2 days a month or something maybe where we could have access to where somebody could come in and make an appointment. They make their appointment with whoever, but then they'd show up here and just like we do our Social Security appointments, walk them to the room and get them online, and then it's close the door and off they go. So we have what that type of thing in our county set up for this other program.
I guess the concern of the VA is who are they seeing during that virtual meeting? Because if a VA doctor is not truly going to meet with them to do or maybe a nurse practitioner do the assessment, and it's just a follow-up therapy session or something like that, and that's all they'll do. I think the problem is that we need to have a place for them to start and then continue, and if the VA would have to be a part of that, unless
Go ahead, Anthony.
I will say we actually do, as a CCBHC, we've recently executed a care coordination agreement with the VA to be able to provide those services. And as a CCBHC, it stands for Certified Community Behavioral Health Clinic, we are actually required to meet the same standards of care as the VA and any services they provide. And so veterans can absolutely receive services at our clinic. And I'd like to connect with you after this to make sure that we can.
Is that more recent? When I was doing the little analysis, it was nobody was, but
that agreement is more recent. We had been working to establish that and very recently got that done, and we're excited about it. Beyond that too, though, we also operate a military veterans peer network program. And I'd like to get you some information on that. We've been working at trying to really expand the footprint of that program, and so that's something else that we can look at discussing.
And is this something that we could actually incorporate where we can involve all the communities? Maybe they can't get to the clinic because it's in Hondo, but something that we could do maybe virtually?
Yes, that was my thinking. I'm just saying we have a spot that if, because I heard, and I'm sorry, your name again?
Kristen Roman, Dr. Roman.
Kristen? Okay, I'll make sure I'm getting it from now on. But I was hearing, Kristen say about people not getting out, and I mean, some of these people that have limited means, to get where they're going, and we could at least have something close where maybe initially, at least they could virtually be able to visit.
He had something.
Yes, sir.
Isn't this one of the limiting principles that veterans have with access to services is that they have to use VA benefits, and those are kind of limited where it would be difficult to see? Are you a private health counselor? I'm sorry, I just moved to Texas.
No, thank you, sir. Welcome to the meeting and welcome to Texas.
I apologize for my informality. I just came on a spur of the moment.
No, first off, I'd like to just comment on your question is that come to our clinic. We can work together and get space to collaborate to serve our veterans.
And I think you are coming on the first, yeah.
So great. To speak on behalf of what Hill Country Mental Health and Developmental Disabilities is we are a unit of local government, of state government. We contract with the state of Texas, the Health and Human Services Commission, to serve as the local mental health authority for a 19-county area, which is a large swath of southwest Texas. Within that, we have a variety of services, and I brought some material here. I'll give it to all of y'all when you leave to get some information on services, supports, our suicide prevention efforts, and all of that. But we accept persons, veterans. We serve a large number of veterans. In fact, our workforce, we have a large number of veterans that are in our workforce, and we're very proud of that as well. But persons are welcome to come in. No one is turned away, depending on their ability to pay or their insurance coverage. They walk into our door. At one point in time, we did have some contracts with the Veterans Administration for facilitation of the telemed services for the veterans population specifically. I'm not real sure what happened with the VA, but they chose not to renew those contracts and just were making referrals to us. But to expand on what Mr. Wynn was just speaking of, we're super excited. We've been working on this, trying to get agreement with the U.S. Veterans Administration for many years. And just here a few months ago, we were able to secure that. And that agreement is to focus in on coordination, collaboration, and continuity of care for our veterans population. So that communication going both ways with our veterans partners within the VA system.
facility, like what's the process? And how long does it take to finally get, I guess, the services they need?
Right now, we operate a clinic here in Hondo. It's at 728 18th Street, right down the road here. And a person can walk in, they can call in. We have it should be the same day or next day assessment for a person that's requesting services to come in and get a diagnostic evaluation and then to determine what the best course of treatment would be. If the person may be recommended to see a psychiatrist for some medication management services, they would be referred on from there. If it is a need for some supported housing services or counseling services, all those elements are derived at in developing a plan for that individual, and we're very close to same day or next day on that right now. Most of those services are done with all of our licensed clinicians that are being brought in virtually, but those are being brought into the local area here through the use of telemedicine services.
And as far as insurance, what type of insurances do you accept?
We're pretty much open. We're actively trying to become in contract with any person's insurance that may walk in, and so we're not just a sole a network provider for Blue Cross Blue Shield, but it's for any of those insurances. We're actively working to become in network for all of those as we speak.
Do you accept Medicaid?
Yes, the predominant pay sources that we utilize is predominantly Medicaid, Medicare. We do have a large uninsured, low-income population that we serve, and all of those are charged on a sliding scale basis, depending on the family size and income. Many of the persons, it might be as minimum as, $5 or $10 a month, or in many cases it may be nothing, depending on the level of poverty that the persons may be calculated as, because we are required to do a financial assessment, of course, with any intake to ensure. But the state of Texas, state general revenue or tax dollars pays for a large percentage of the services that we provide, and so it's a benefit to the state of Texas.
To people, regardless of their ability to pay, so you've got services for those people?
Absolutely, and that's one of the key factors. As Mr. Wynn was speaking of, we've just recently attained the national certification as a certified community behavioral health center, which we're very proud of. That's a 3-year certification, and one of the requirements of that is that you are serving your communities and you're collaborating and you're coordinating with Veterans Administration, all other parties, and that you will serve somebody walking through the door regardless of their ability to pay. And we have a very heavy emphasis as well upon crisis services, and we partner very closely with our partners here within the Medina County Sheriff's Office and with the jail, and I'm happy to say we are being able to bring some additional resources in to expand our forensic population. And as much as Judge Cashin was speaking of, too many times we see too many people who may be in a mental health crisis and they end up in the jail on some misdemeanor charge or something like that. And we believe that the sooner that we can intervene in the mental health crisis, hopefully we can avoid a person going and suffering in jail and working their way through the very expensive, judicial system that sometimes becomes a revolving door for those individuals and ends up them just not getting the services and supports.
When you mentioned crisis services, is this a walk-in center? Is this a mobile unit, or?
We operate a 24-hour-a-day, 7-day-a-week mental health crisis hotline. Persons are also welcome to call 988, the National Suicide Hotline. And if a person was to call the 988 and was determined that this person was in acute level of stress or at risk to themselves or others, or at acute risk for further deterioration of their mental health, that may put themselves or others at risk, they will then connect with our local crisis team, who will then respond and conduct an assessment. Persons sometimes do walk into our clinic who are in a crisis, and we will certainly assist those individuals in gaining access to a crisis assessment to better determine what the needs are. If persons are requiring a level of care beyond what can be addressed on an outpatient basis, we do contract with a number of inpatient psychiatric hospitals in San Antonio. And so we work very closely with our inpatient partners in facilitating those admissions, as well as we do have some resources to help pay for those admissions for persons who do not have insurance coverage or the ability to pay for them themselves.
If I could just speak for a second. My name's Carly Cannell. I'm the Chief Public Defender. And we have just applied for a grant that will have five mental health caseworkers to try to help the population who is in the jail or in the revolving door try to find services or placement when they get out or when they get in, whatever the situation is, to prevent the cycle from repeating over and over and over again. And we do have quite a few veterans that are, unfortunately, in our, on our list of clients. But our goal is to prevent the cycle from repeating over and over again, and to prevent the months and months. I mean, if somebody's charged with a felony and they're found incompetent to stand trial, they're waiting more than a year in the Medina County Jail often in order to get a placement in the state hospital. And they've already been determined to have a profound mental health issue, and it doesn't help them to be sitting in jail that long. And then they get to the state hospital, hopefully regain competency, but then they have to come back to the jail in order to deal with the charges. And we have to get to them quickly before they lose competency again, and it's a really bad problem. And so we've applied for a grant. We'll hear, I guess, July, August, whether or not we've gotten it, but they're determining at $240 what the budget's going to be for next year for TIDC, how much the legislature is going to be giving. So hopefully there'll be enough money that we will get that. And then I would like to be able to reach out to all of you so that we can work together to help find groups that can do that.
Absolutely. I'll be glad to share my direct contact information. I'm very excited to announce, after a very long period of over about 15 months, we applied for a grant to embed a mental health professional into the Medina County Jail, as well as a certified peer, to be able to work with pre-release planning and post-release continuity of care, and that we would also the grant to be able to hire a qualified mental health professional and a certified peer to work with our mental health deputies in the community to respond, and hopefully using that program as a diversion so that we can reduce the recidivism back into the jail.
That's wonderful. Yeah, that would be great.
And so we are active right now. We're in the recruiting process. So if you happen to know of
You've gotten the grant already?
We've gotten the grant. We've got the funding has been secured, and right now it's I know. See here, in totality, I think it's about $250,000 a year, which will be bringing 4 employees to help address this. One is through the Office of the Governor. That we secured it, and then we received another grant through the Health Human Services Commission for the mental health justice involved individuals, and so we're very excited about getting those. And I understand that as of May 5th, the Medina County Commissioners Court meeting, they will be reviewing some interlocal agreements to get those on board, so that once those agreements are in place, we would then have some legal binding agreements between how we move forward with these. But we've been working with the Sheriff's Department, and through the interviews and reviewing of applicants and so forth as we speak. I think they were even interviewing as of last week. So.
That's great.
One thing I do want to add, and specifically to
your attorneys there that work with you. It was brought up a couple of weeks ago in district court in reference to a defendant that needed medications but was afraid to take them because he was going to be charged for them. And I assured the attorney in the court that's not an issue. If the state hospital has said they're going to take these medications, they're going to get them. And I did speak with the state hospital. We discussed it at length. And there are resources to help us recoup those funds to make sure we're not hurting, because the only funds we get are the taxpayers' funds. We don't get outside state resources or anything like that to recoup for medical. So those are things that everybody does need to know. And we are working with them to try to have a better relationship to try to get these things smoothed out.
So just for clarity, if somebody is getting mental health medication in the jail, they're not going to take it out of their...
After discharge from the state hospital because of a competency eval, yes.
Because it is a big issue with our clients, and it's one of the reasons we can't get them to take their medication. Even if they've been prescribed it, or somebody's come to see them in the jail before a comp eval and they're told they need this antipsychotic or this antidepressant, it comes out of their little piddly money that they want to be able to use in order to buy whatever it is they want to buy. And so they have to make a decision. And a lot of times our clients who need like an antipsychotic or something like that don't make good rational decisions. And so they're not willing to pay out of their money in order to get the medication that they need.
And that is one thing that I do try to do. If one of the attorneys, any of the attorneys from either side, discuss with me, hey, we don't know if he's slipping a little bit or she's slipping a little bit. We don't know if they're taking their medications. I'll follow up and I'll go speak with that defendant. Like, look, you need to take those medications. We're not going to chase after you after you get released because you owe us money.
Right.
You're going to get the medications regardless. Whether you have money, you don't have money, you're going to get it.
But the problem that we have when we're trying to convince them of that, and I'm just telling you all this just because I think it's important that people understand, if they get $10 put in their commissary, and then they take medication, and it's $5 a pill,
right?
And then they can't buy ramen noodles or whatever it is that they want more than their medication, because a lot of my clients don't really like their antipsychotic medications very much, but they really need them, and it makes it where they can function so much better, and they might not become incompetent. They might be able to actually help us with the defense of their case, and so we can move forward. And so that's an issue that I know that you can't solve immediately, or anyone probably can't solve immediately, but that is something that would help with the recidivism and with the ability for us to move forward on a lot of cases. If they're getting the medication, but they're prescribed for their mental health issues, we can do a lot better with our clients. It's just simple.
One program that we're very aggressive in is that once a person is released from incarceration in the jail, but we've got a very aggressive patient assistance program where we're working with the pharmaceutical manufacturers, and we're able to secure medications free of charge for individuals who do not have insurance or a means of paying for it. And it's been very, very successful in accessing and helping covering the cost of, the antipsychotic medications are extremely expensive. And this is a great benefit for a large portion of the population we serve.
And if you have that person embedded in the jail and you can let people know before they're released, like, come to MHTD, we will get you, like, that would help a lot, because we tell them, but then maybe they're serving 60 days or maybe they're serving 5 years and they don't realize, they don't remember what we told them, they don't listen, they don't understand completely. But if somebody tells them right before they leave, go directly from here to MHTD, this is what they can do, that would be really helpful.
Well, and to add, that program is designed to have we can follow up for up to 90 days with that individual outside of the jail to make sure that they get connected with the system, because a lot can happen between the jail doors and our clinic.
Oh, yeah.
And that's something that I know I've talked with several members of the community about leading up to this, and one reason I'm very excited about this opportunity we've got this 90-day follow-up period where essentially they will still be on that continuity of care caseload until we know that they are set up with the appropriate services, and even thereafter to make sure that we're continuing with those. And so I think that element of the program is going to be crucial in ensuring that we effectively divert from that revolving door that we see.
That's fabulous. That's great.
Well, we know rural is a barrier, being rural, but how about stigma? Like, what do you guys see in Medina County as the stigma to seeking help? Because we can have all these services and get all these contracts, but if the community has this higher mental health stigma, which rural tends to, gender plays into it, culture plays into it, what is Medina County doing about the stigma?
I brought a bunch of information here today to be able to share, and one of the things that Sue, that's up here with us, is not only is she responsible for coordination of and operations, the day-to-day operations of our outpatient mental health clinic here, but in engaging in community meetings, engaging in the various activities in the community. We have a very aggressive, community education programs that are going on, and it is more difficult in the rural communities, no doubt. But I know I've been working in the outpatient mental health business for almost 40 years now, and it's all built on relationships. It's who you know, and handshakes around the table, and the people we're meeting in here today. We've got 2 new connections here that are going to be a great resource for the community. But we're trying to share that, and the suicide prevention is certainly one thing. I know. I was telling Joan here. I said I'm a very big proponent of services to our veterans population. I'm a proud father of a veteran who did his 20 and is now home and safe and going through his own struggles. And with that, suicide prevention we see is huge among the veteran population, and the post-traumatic stress disorder we see too many of our sons and daughters coming home with is something that I think it's better now than it had been previously, because we are seeing more people reach out, and when it may take a while though for somebody to reach out, but once they do make that very difficult step to walk out the door, during our new employee orientation, I often speak to the fact that we've got to have a welcoming front desk, and we've got to have excellent customer service, because we may have the best psychiatrist in the world in the back room, but if the receptionist is not welcoming, and doesn't treat me with dignity and respect, I'm going to turn around and walk out, and I'm never going to see that psychiatrist. So I think it's all about relationships. All that's big, long way of saying is, and we welcome an opportunity to participate in any of those collaborative efforts to help address the stigma.
I'd just like to say we're from Medina County Health Unit. And so a big part of what we do is education out in the community. So we do try to address mental health and trying to work on that stigma of that also. So we do try to do that. And something I didn't know about, I don't know if anybody's here from the Extension office, there's a program for farmers for depression. Now, I don't know if anybody was even aware of that. So, we try to promote other programs like that as well as the veterans and stuff, and try to get the resources out there. So we meet with a lot of community members out in our daily work that we do, and so we do try to address that as well.
Yes, and thank you for bringing that up, because the Texas Health and Human Services have and various other departments have a really aggressive approach. I think it's Texas Department of Agriculture of addressing the suicide rates among our farmers. I know in my office I've got one of the bumper stickers that I go around and I'll put it on my buddy's tractor or something, where it helps to put it on help prevent suicide among our farmers. And it's a unique number of persons who are from the agricultural end of the field, and but also specializing in the mental health and the safety and of that population of our communities.
You had mentioned that you make referrals for psychiatry. I know in rural areas that's generally really challenging. Is there a private practice, and again, I'm very new here, is there a private practice psychiatrist or psychiatric nurse practitioner within a reasonable distance of Medina County?
I'm not aware of a private practice. Certainly we employ psychiatrists and psychiatric nurse practitioners. Yes, sir. We have in-house staff. Due to the large geographic areas, as you mentioned, I think it took us almost 3 years to find our most recent psychiatrist because there's such a shortage across the state. So we do provide those services through the use of the telemedicine or the video equipment, but we employ, I'm not sure how many psychiatrists and mid-levels at this point, but we cover all of our counties with all of our own staff, and then we do supplement that with contracted agencies who provide psychiatric crisis evaluations and stuff like that. And I'm happy to say that we're in the process of just finishing up, so that we not only will we have the outpatient clinic-based psychiatric services from a medical staff, the psychiatrist or psychiatric nurse practitioner, but we'll be able to bring that on as a 24-hour-a-day service in case of crisis for emergency evaluations by a psychiatrist any day of the week.
I think one thing that would not be bad to explain is the peer involvement that we're talking about, because I think that goes to what Kristen brought up about the stigma that's involved, because we're in a small community. Joe knows Sam. If Joe is going in and getting treatment, Sam knows about it. So peer involvement, I think, is a big deal on what we can provide to some of these people.
I just happen to have brought, Judge, a number of information in reference to a peer program for y'all. So one of the things, and I think I couldn't agree more, because someone with a lived experience who's gone down that path and has gone through their own recovery can serve a huge role in engagement. That's why with the program designed for the jail-based services, as well as our collaboration with the Sheriff's Department on with the mental health deputies in responding on an outpatient. But that continuity of care of having that certified peer who's been there and done that, to be able to go out and follow up with that individual, maybe when they're released from the jail for up to that 90 days, or going in there meeting with the person that may be incarcerated in the jail and encouraging them the benefits of taking the medications and the importance of following up with their appointments. But as we're out there doing the crisis work as well, many times the certified peers, and these are persons who've had some challenges among themselves, but they've gone through extensive training and testing and certification, statewide certifications that can help engage. Engagement is probably one of the biggest and most difficult parts. Too many times persons will get to feeling a little better and maybe they don't think they need their medications anymore, or that another stressor pops up and they have a relapse, and that peer can make a huge difference. And I look forward to being able to share some information on peer services.
I'll add too that one of the benefits of peer services, particularly having a local peer, someone local with lived experience, is that so much of combating stigma is understanding the culture of the community, right? Because stigma can look different from community to community. And a lot of it is just using things that apply to the current community's daily living. And an example of that, I grew up in a small town, Karnes City in Karnes County. I don't know if anyone is familiar with that. But I can tell you that if someone had come to my school and talked to us about mindfulness meditation, I probably wouldn't have understood what they were talking about, right? But that looks different as a form of stress reduction in each community. For instance, for a farmer, that might look like taking a walk to check on their cattle. That might look like going hunting. And so really having someone who is local, who has that lived experience and understands that culture can be critical when we're talking about the overall combating of stigma. And so I just wanted to add that.
In addition, we really have a heavy focus on community education. We provide mental health first aid training throughout the areas, and certainly willing to do that and basically help someone identify when there may be some symptoms. But it's kind of funny when Anthony was talking. I started out my career as a community-based crisis worker and caseworker, and I grew up and spent most of my life out in West Texas, and so most of the time I was out in the middle of a cotton field. I did most of my work in the cotton field or chasing somebody down off of a tractor someplace out there, because I couldn't ever get them to come into the clinic. And so it's very important to go to where that person is at.
I think for the grant, for the Attorney General grant, is one of the focus I have is meeting individuals where they're at. If we can have our peer go in the home and do televideo with them, or we are not pulling them out of their home to go to the ER or somewhere. Like when we can meet them in their home, like the chances of falling through are much higher. They have chances of engaging. So like one of the big purposes for me with this grant is finding someone, like I want them to go in the home and meet people where they're at, not to have to come into four walls.
One thing that, yes sir.
No.
We love it.
We all know, especially those in the legal community, that at the root cause of a lot of mental health, I don't know what's first, the chicken or the egg, is substance use disorders. Does anybody in the community provide primary substance use disorder treatment, or you guys just primary mental health? Or what happens if someone comes to you that's their primary, we need to detox them type thing?
Yes, sir. It's been very challenging in Texas, across the entire state. The funding for substance use services has been very limited. I'm happy to report that we are actively engaging and trying to work through some contracting with the state of Texas to bring some substance abuse services that would be funded by the state to the area, as well as working through the licensure requirements that have to go through to be able to provide those services. Right now we do a lot of some more of education than we have been doing of treatment and passing out naloxone and but trying to fight the opioid tragedy that's going through the country. But certainly a person comes in right now, that would be a component of their treatment. Like you said, you don't know if it's the chicken or the egg, and so we're going to work through them and provide assistance for persons that do have much of the population that may have a co-occurring disorder. So maybe they're having problems with depression and they're trying to self-medicate with alcohol or some other type of illicit substance. We do have services and supports for that population that we are actively working on, but we are trying to expand to the single diagnosis substance use disorders.
What funding do y'all have for that? Because I think he's got a good question. people that have mental health issues, as soon as they get out of jail, they're going to self-medicate. They're not going to go and take the medications that are prescribed. They're going to go to whoever they buy their drugs from and use them.
So what do y'all have to kind of follow up on that toward substance abuse?
Well, all of our services typically are based on a voluntary basis. So a lot of that, unless a person has gone through court-ordered outpatient mental health services. And that is another tool in the toolbox that some of our communities are exploring, and with specialty courts designed specifically for the mental health, or specialty courts for substance use courts. And some of our larger communities have put together some assisted outpatient treatment teams, where they're working very intensely with a population that's person may be released on personal recognizance bond or something under the conditions that they follow these elements. And we're just getting early into those. Michelle down here, as being over our forensic services, has been starting some of those programs up in the Hayes County or in the San Marcos area, which has just recently been kicked off. And we've contracted with the county, where they've chosen to provide some of these services, and then we bring in the clinical professionals to serve in that capacity alongside the county.
Well, this may be pushing it, maybe, but like with pretrial services, Christian's here. With pretrial services, if we have somebody that we're going to kick out with the arm on, we can put all kinds of conditions on them to report, follow whatever kind of services. Is that what we need to be doing?
Certainly, I would encourage to have a conversation with Michelle. Let's figure out how best we can collaborate to see what those conditions and what may work. For each case is going to be different, but we welcome the opportunity to have collaboration. I think this is one of the greatest benefits of having these type of meetings and conversations, is that as Anthony said, every community is different, and so where can we have some quick wins as we work on some longer range strategic activities to best serve the community.
I will say that if there's a defendant that comes across my desk that they want me to look at, I do get with either pretrial or the judge that magistrated them and request those bond conditions.
I mean, to me, that's the low-hanging fruit. We just sit there and say, tell them if they're going to get released, they're going to report. We know if they violate, there's something we can do about it, because they're not sitting in jail. We've got them out at that point.
Yes, sir. And for the public, I'm very proud of Medina County, because Medina County pulled together here some time ago, collaborated, I believe it was with the Health and Human Services Commission to do a community-wide, what's called a sequential intercept mapping, and looking at all the different steps of the interface of a person with mental illness or some type of mental health crisis that they've been going through, where they intersect with the judicial system. And intercept 0 is basically the first step. That's typically with our crisis worker. Intercept 1, in this example, would be with like the law enforcement being called in. But as you go on down that tier, you end up with the courts and then probation, and really figuring out where to address these elements and try to address them as early in the system as possible. So hopefully the person doesn't end up in court if we can get them that far. But if they are there, we need to address those other elements within the sequential intercept mapping. And Medina County had a great representation there in that. That was a 2-day exercise. And many of the people on this side of the row there were at those tables. And so very aggressive in trying to figure out how best to serve that population.
Anybody else, anything y'all want to bring up? I want to thank everybody for showing up today. I want to thank Jana for kind of coordinating all of this. She does that every time. This is not going to be the last meeting we're going to do on this. I mean, I've said this 100 times. It feels like we're making some progress, but we're making slow progress. But we're going to continue to look at this. If at any time y'all have questions or something you feel like needs to be done, feel free to call our office, Judge Lewis's office, Sheriff's Department, our LMHA, and see, what we need to do. We're more than happy to try to do it. I guess we're done with this. Go.
Sorry, I've been thinking about it for at least the last half hour through this meeting, but I think there are at least a few in here that are just here because community, and that was the intention of this. And I always say, especially when we talked about the stigma, we talked about all those things. So for me, when the community just shows up and comes and asks the questions is important. And my hope is, the only way we can do this is to have a public meeting, right? It's the only way we get the word out. But when you're talking public health or you're talking mental health, the sensitivity around it. And so I look at our friend Anton over here that I'm used to all these cameras and recorders being in every commissioner's court meeting, and we're good with that, we expect that. I'm just going to publicly ask Anton to be sensitive to what's written here. We kind of got down in the weeds on some things that we don't even have answers to. And I would just ask, especially all the pictures this side of the fence, I think are great. But that side of the fence, not so much to me, just because, we got people here that were willing to show up on something that sometimes is hard to show up on. And I just appreciate it if we could keep that the best we can as you're doing the story. Even though we appreciate you being here, because you already write a good story, but I just wanted to say that as we're closing up here, so you help us with it. And then we'll be back for some more. Thank you.
Thank y'all.